Hey guys, it's just Nick here from Scarborough Physio and Health. So I thought I'd just film a quick little video just about something that I'm seeing a lot of lately here in the clinic that a lot of people are asking me about. It's on the topic of bursitis. So bursitis is pain that you can get either around your shoulder or right on the side of your hip. Now it can happen to any of us, but it's probably a little bit more common in women, especially in the hip. And what it is where there's a little fluid sac that sits between the collarbone and the muscles of the shoulder that join on the top of the shoulder. And when we move over time, it gets irritated and it can swell up. Now, a lot of people have been asking me, why don't I get better when I have bursitis after I have a steroid injection? So the normal pathway with bursitis is you go to the doctor and they do an ultrasound of your shoulder, and the ultrasound shows you've got bursitis, and then they send you for an injection. And the injection shrinks the bursa, so it makes this thing go from swollen down to really thin again, but the pain doesn't completely go away, and that's worrying people, you know, as it would if I didn't know anything about physio or medicine or bursas as well. But what you need to do after you get the injection for the bursa, you got to give it a few days to recover and for the bursa swelling to reduce, but then you need to do specific exercises that a physio, you know, like me, one of my team here at Scarborough Physio, any physio can prescribe you. So the main problem is that you have bursitis and you go to your doctor, you have an ultrasound which shows bursitis, and then you get the injection and you don't feel heaps better. And what you need to do is make sure that after you get the injection, you give it a few days or you give it a week, and then you start rehab. Because if you get the muscles around the shoulder or around the hips stronger, the shoulder or the hip will start to move better again. And when the shoulder or the hip's moving better, there won't be the pressure or the friction on that bursa that there was to start with. So, you know, an example is I saw a lady today, she's got a bit of a sore hip. She had an injection into that hip 3 years ago and then it didn't work. And then she waited for another couple of years and she still had the problem. And she had an injection a couple of months ago and it didn't work as well. And so I tested her hip and all the muscles around it were stiff and weak. We worked on the muscles. You know, immediately she tested better and she had less pain when the muscles were loose. I gave her the exercise to do, which she's going to do every day. If she's good, hopefully she is, and it's going to work. So if you need some help with bursitis, just, you know, get in contact with us, comment below, just let me know. Alrighty, thanks.